Before you think that inflammation is just a buzzword and something that isn't affecting you in your life or something you should pay attention to or be aware of and conscious of, let me tell you the story about Sarah. Sarah was a really high energy woman, mom of 3. She ran her own business. She ran marathons, exercised, ate right. Really looked like she was doing quite well from a health standpoint. But then slowly over time, she just wasn't recovering from her workouts like she used to. She began getting more and more soreness. This then led into more chronic aches and pains, muscle issues, joint issues, overall fatigue. No matter how much she slept, she felt like she just couldn't get enough energy. Then she was getting weight gain, getting gastrointestinal issues. She went and saw her doctor. Doctor ran tests, prescribed some different medication, saw how that was going. But really, it just continued to build. More and more issues with her joints, her muscles, the fatigue, the gastrointestinal, the weight gain. To the point when Sarah finally came to see me, she said, Dr. Schulke, I don't even feel like I recognize myself anymore. And many people can relate to this because they have in their mind how things once were, but things had just slowly built up over time. Eventually, we were able to correct all of this in her life by balancing out her inflammation, which then corrected some of the autoimmune issues that she was experiencing, the joint and muscle pains, the weight gain that improved as well, and the energy to where really made a complete difference in her life and her kids' lives to be able to regain that energy and reclaim her life. So what is inflammation? It's something, a buzzword that people hear of a lot, but what is it and how can it be affecting you? How can you identify if it is affecting you as well? So there's 2 types of inflammation. There's acute inflammation and chronic inflammation. Acute inflammation is that, like you sprain your ankle or you have a flu or a cold, it's the body's defense mechanism against harm. That inflammation turns on, which helps kickstart the body's healing mechanism to rebuild and repair. The problem lies when that acute inflammation gets dysfunctional or disorganized to the point where it becomes chronic inflammation. And this can be a low-level chronic inflammation. It's not like you have swelling or a fever all the time, although you can, but most people don't experience it that way. And in a minute, I'll go through what are some of the common symptoms that people can experience. How does it actually affect us? People wonder, like, well, how does inflammation even cause these problems? Number 1 is inflammatory molecules. They create actual tissue damage within our tissues of the body, leading eventually to disease or cancers. So they disrupt the function of the cell and the function of the tissue. Secondly, they create endothelial dysfunction. And what that is, that's the blood vessel lining. So then that blood vessel lining becomes inflamed and irritated. And then that can, of course, lead to cardiovascular disease, or like I see a lot of neuropathy that can lead to neuropathy because the little tiny blood vessels that are supplying the nerves become affected. It also can lead to insulin resistance and diabetes, and then that snowballs into other issues as well. It can lead to neuroinflammation, inflammation of the brain, leading to cognitive disorders, mood changes, many problems that we see on that side of things. And then lastly, there's this chronic inflammatory feedback loop where the inflammation that you have, even if it's just a low level brewing ember there, that creates a feedback loop where that little bit of inflammation causes more inflammation, and that causes more inflammation, and then this is what snowballs into all of these issues. So how can one identify if they have inflammation, chronic inflammation that's affecting their lives? Well, one of the things that you'll notice if you have this is persistent joint and muscle aches and pains, or even arthritis. And it seems like, okay, if you're going to the chiropractor, you're going to the PT, you're trying to work on these issues, but you're just not gaining any traction. It's not improving the way that you think it should be improving. That could be one indicator that chronic inflammation is at the root of your issues. Also, fatigue. I mentioned, like with Sarah, no matter how much sleep she got, just seemed like she was always tired. Fatigue's a big one. Gastrointestinal issues or food sensitivities, that's a big one. Skin disorders, eczema, psoriasis, weight changes, and or weight problems that it seems like no matter what you do, the weight just won't come off. That can be because of chronic inflammation. Mood changes, cardiovascular disease, insulin resistance, and diabetes. And then, of course, autoimmune issues, respiratory issues, even like asthmas and things like that can be affected by inflammation. And then the cognitive decline as well. So you would think that, okay, obviously inflammation is really bad. Why don't we just decrease it completely and get rid of it? Just like people don't want to be on prednisone or things for long periods of time and the bad effects that can occur from that. We don't want to completely reduce inflammation because, as I mentioned before, it is our body's defense mechanism against harm. It helps to kickstart the body's repair process and recuperative process. So there is a delicate balance there between too much and too little. And next we're going to be going through how do you find that balance? And we're also going to go through how do you decrease it appropriately. So make sure you're subscribed to the channel, and we'll be going through these next steps in future videos. Thanks.